Good morning. Oh, come on. The group before this did much better than you all. Let's try one more time. Good morning.
Good morning.
It's lovely to see all of you here. I'm going to make a quick request before we get started. For the folks who are kind of sitting over here, where I'm going to have my back to you, and we can't really see you with the light, would it be possible to kind of scoot in a little bit so that we can be better panelists in engaging our audience? Thank you. That's awesome. Good collaboration already. So my name's Casey Kelly. I'm the Chief Innovation Officer at the Meadows Mental Health Policy Institute. At the Institute, we are uniquely suited in the ecosystem in that we operate at the intersection of policy and programs at the federal and the state level. And we work in health systems and school systems and justice systems to help those systems serve people's mental health needs better systemically. And that on-the-ground work really does feed and fuel the work that we do on the policy level. And I am delighted to be here today with this amazing panel to talk about some work that we've done in Florida. You may think, and you may know, Florida for its beautiful beaches and sunny skies, especially this time of year. But you may not be aware that there is a big effort underway by the business community in Florida to improve mental health outcomes for all Floridians and to position Florida as a leader for driving mental health outcomes on behalf of employers and citizens across the state. And so today we're going to talk a little bit about the work that is underway across the policy and program sector and how tech companies and health plans in school systems and in healthcare systems are helping to drive improved outcomes across the state. But first, I'd like to introduce our panel. So all the way down on the other end, we have Katie Uter, who is the Chief Operating Officer and the Chief Financial Officer at the Florida Chamber of Commerce. And she really has been our partner in crime in prioritizing mental health in the state of Florida. Next to her, we have Josh Gullum, who is the CEO of Hazel Health. Hazel is the nation's leader in school-based mental health services and driving increased outcomes or improved outcomes for K through 12 youth. Next to Josh, we have Dr. Caroline Carney, who is a internal medicine doctor, a primary care doctor, and a psychiatrist, and she is the leader of Magellan Health and the chief medical officer there, where Magellan is really focused on improving the quality and delivery of behavioral health care across health plans in Medicare, Medicaid, exchange, and federal services covered, and federal services. And Caroline's going to be able to speak to the role that employers can play in selecting their health plan coverage. And then finally, we have Robert Capobianco. And Robert has given me permission to call him Cappy on this panel today, which I am thankful for. But Cappy comes to us from Neuroflow, where he's the chief commercial officer. And Neuroflow is a leader in helping health systems really think about their population behavioral health enhancements from a tech perspective, and has been positioned as a leader in risk management and care integration by leveraging technology. Can we give them a round of applause? So Katie, I mentioned that we had partnered to help you and the Florida Chamber of Commerce do a statewide assessment of what were the opportunities and the needs to improve mental health outcomes in the state of Florida. Really, because that was your interest in being the first ever business-led mental health initiative that could be executed in Florida, but also be an example for other states to follow. Can you talk a little bit about why did Florida want to do this, and why is the Chamber interested in mental health?
No, thank you so much, Casey. Welcome, everyone. I'll probably just start with a little bit of an overview because it's very strategic of what the Florida Chamber is doing. So we are, I think, and I was talking to Rob about this earlier, right? So we are not a state entity. We are a private organization. We do lobbying and political work, which is our differentiation. But about probably 4 years ago, we did a massive report in where was the world going to be in 2030? Where was North America going to be in 2030? So where did Florida need to be in 2030 to be the 10th largest economy in the world? And what that built out for us was 6 pillars and 39 goals that we measure with data that's continuously updated, right? So we are actually, one of our goals is childhood poverty. We've got third grade reading scores, kindergarten readiness. But one of those 39 goals is being the top 5 state for well-being, right? And so that's very specifically what we're trying to address through the Leadership Cabinet on Safety, Health, and Sustainability. So about 5 years ago, the Florida Chamber, underneath the new 6-year strategic plan and part of the 2030 blueprint to address top 5 state for well-being, we launched the Florida Chamber Leadership Cabinet on Safety, Health, and Sustainability. That is led by the global leaders on safety, health, and sustainability. So we have the Worldwide Chief Safety Officer at the Disney Corporation, the former head of OSHA, Coca-Cola Florida, that all sit on this advisory board. And that'll be important in a minute to understand why this has been a business-led initiative. We run a safety council that is all about tactical safety trainings on ocean, forklift, and fall protection. Our health council is really focused on the long-term systemic issues, which is mental health, our opioids, and our sustainability council is cleaner air, cleaner water, and cleaner land. So structurally, that is sort of how we are executing through this. But when we launched the Leadership Cabinet, the first thing we did is we did a statewide report on where was the state of Florida when it came to safety, health, and sustainability, when it came to the rest of the country. So we knew strategically what did we need to focus on to actually get measurable outcomes in these categories. So we started looking at mental health back in the summer of 2020. Because when we were doing our health research from an overall perspective, that is where we really started to understand the undercurrent of mental health and what was happening, especially in the midst of COVID. And that's when this journey really began for us. And so a lot of the work we do at the Leadership Cabinet, we have our overall data, but then we do very specific data on really high watermarks. And that is when we got very fortunate to work with Casey Kelly and the Meadows team to very much do a deep dive on mental health landscape in Florida, what was sort of systemically inhibiting a lot of our outcomes, and what needs to happen to drive it. It's very important in the business community and our advisory board in the Florida Chamber because it's our workforce. So if we want to be the 10th largest economy by 2030, it comes down to our workforce, the health of our workforce, sustainability of our workforce, and how they feel every day when they're showing up to our workplaces. And we need them to be their full selves and thinking clearly and striving in goals. And we all know that's very hard when we're not feeling optimal when we're walking into work every day, right? So it is very much a business focus. We've got 3.7 million employers in the state of Florida. We employ and privately insure over half of the non-elderly Floridians, and we privately insure 2 out of 5 children in the state of Florida through the private sector. So when you align the private sector behind this and you look at it as a workforce issue, we can actually make some tremendous impact on reaching these goals and these outcomes. But that's why we look at it very much from a business perspective and a business outcome. Our health council has done a lot of this work, and those that sit on that. It's chaired by advisory board member Dr. Jeffrey Koldman with Advent Health. He was the former personal physician to the White House for President Obama and President Bush. And so we already have a large contingent of the private sector behind this, and it's very important to them. But ultimately, Casey, it's coming down because it is a workforce issue, and it's everybody that's walking into our workplaces every day.
Thank you, Katie. That was a great level set and overview, because I think sometimes that people don't really think about the role of the business community or the role that the business community could play in mental health care. And at the Meadows Institute, we were delighted. I mean, part of my job is to identify innovative or new types of partnerships, and this certainly was something that I had not thought of before until you brought it to our attention. And I am hopeful that this will be just the beginning of other ways that the business community can help us with improving outcomes. But let's dive in a little bit. I mean, Katie obviously is clearly committed to outcomes and data. She is amongst a few of the partners that we work with who I can never give enough information or enough data. And it makes it really fun to work with her, that sort of spirit of understanding not only the need, but where those opportunities for solutions with tremendous precision. And so, Cappy, you and I have also talked about data. And when Cappy and I first started talking, I understood about 10% of what he was talking about related to data infrastructure and value-based care and actuarial numbers. And so I've come a little bit of the way, but I'd love for you to share some of the ways that that NeuroFlow is working in Florida and beyond to really think about the role of measurement and data infrastructure in our health systems across the country.
Sure. Thank you for having me, and thanks to everybody for their time. Specifically in Florida, we work with populations that, well, actually I should say our clients work, and we supply the technology so they can do the good work, with their patients and their members, depending on kind of what side of the table we're sitting on. But specifically in Florida, the villages, we do assessments for VA, Orlando being one of the biggest centers there. In the state of Florida, we worked with the Florida Panthers in the 2024 year, and I have to say, since they picked NeuroFlow, maybe that's why they won. But really what we came there to do, and it aligns really well with what I've seen in what's been created by the Commerce and also Meadows, is an infrastructure, right? How do we go out and create a way of getting to the data that is so important about total health and what is happening in the mental health, so that whole data collection and assessment piece of it. At the same time, we have a engine that allows you to take that in, and organizations like Magellan use this, and you may have heard Caroline yesterday talk about, or Dr. Carney, I'm sorry. It's really about getting into specific interventions in the way that the PHQ score might affect somebody's total health or another piece of an assessment, so that they can get to a guided journey around how does mental health work its way into the total cost of care. So that's really what we do in the state of Florida, even in the villages. So we go from child all the way to older care in the state. And I think it's because of different policies and actions that we've taken here that continue to drive that adoption around not just the ability to engage the employers in what they're doing or different sites of care, but provide the infrastructure around data collection, a standard way of measuring it so that we can get to the outcome. And then third, really involving really vulnerable populations in the state, with that 40% number of children, with the 920,000 or so that go across the spectrum in Florida.
And just to follow up quickly with you on one specific topic I know that we've talked about is the role, the fiduciary responsibility of employers, and that responsibility that they have in how they think about benefit design and measurement.
Yeah, and I think there's another it's always good when you have a collision of different types of rules and policies and pieces coming into play. But if you think about the Consolidated Appropriations Act, it's the CAA. It was passed many years ago, but now you're starting to see the implementation of it. And we have to be aware, and I think this is the great part about the plan, is involving the employer. One, because they still pay for a majority of care in the country today, but two, the fiduciary piece of why did I design it this way? And that you have to be able to supply the access that is congruent to the population you're serving, which is the employer population. And one of the biggest needs that are being highlighted, everyone thinks about it from an RX perspective, but it's quickly becoming into, because we're seeing a 20 to 30% increase in behavioral health services. And so that has a direct impact in the benefit. And now that when we say fiduciary, what we mean is liability. And so you can, as the CFO of private organizations, you can now be liable for your benefit design. And that's a pretty big movement, right? When we switch the payment responsibility in that way, they now are more motivated than ever. And I'm not saying it's because of the bill. I think it's what's happening in our society as we've all been coming through the post-COVID world. That it's just one of the big pieces of, concern. And since they buy so much of it, right, being held accountable for that is a big shift in the population. So I think that's going to drive a focus around behavioral care.
Well, and I love the sort of thinking about this opportunity as a new and perhaps different lever that we can leverage as a community to drive better outcomes and really motivate behavior change from this stakeholder group that has a lot of power when it comes to how health plans, health benefits packages are designed and how they might be able to optimize behavioral health services. Caroline, I'd love to now kick it over to you as, a leader in both the clinical world and the health plan world, and knowing about some of the tech infrastructure that Cabby was talking about that NeuroFlow provides. Like, how does that land in your world about how these new technologies might be able to influence the way healthcare is delivered and the ways that and how employers are providing these benefits?
That's a great question, and one that I want to start a little bit behind before getting to the technology part of it. I think employers need to approach behavioral health in their employee populations by listening to the population and really understanding what the needs are. Is an EAP the right thing to do, or is it in building out a better behavioral health benefit for those individuals? Secondly, employers can model and walk their talk. So giving lip service to behavioral health and saying, you get 6 EAP visits now or something, if it's not a meaningful change, if it's not going to be meaningful for the employee, walk the talk of what you're doing, bring that, have those employers bring the right services and demand the right services from whoever their vendors are, including measurement-informed care. We don't know outcomes that we don't measure. We can guess what they might be, but we don't know them unless we truly measure those outcomes. So I think stepping back and thinking about the system holistically, we talk about technology. I think that technology is a critical role for employers to embrace and should be part of any of their benefit design. But I think it needs to be part of a benefit design that is inserted with other parts of the care continuum. Those of you who know my work at Magellan, we use NeuroFlow. In full disclosure, we use NeuroFlow. But I have never said, here, go use this app. It is fully integrated into the work of our care management team, of response services teams. So it's not just something that's happening off on the side. The data that we get from NeuroFlow are actionable. We can respond to those data in real time if someone has an urgent alert or an emergent alert for suicide or self-harm. It's important that it's not just something sitting off to the side, that it's part of a system of care. and that those alerts and triggers find someone. So I'll talk about a statistic again. I did talk about yesterday, so sorry to repeat the story. In a couple of years ago, we started using NeuroFlow across our whole EAP employer book, hundreds of thousands of lives. January 1, everybody got it. But the employers out there who knew that their employees were getting this, some of them advertised it. Some of them refused to put it on their web pages, and they didn't talk about it. It was just another tile sitting on, the EAP benefits page you get. That is not the way to walk the talk of behavioral health. We have to reinforce it over time, not just at annual benefits, sign up, but reinforce it monthly, bi-monthly, do the kinds of events in there. Why is it so important? For those people who did sign up for using the tool, we had estimated that 2 to 3% of the population would have urgent or emergent alerts. It has consistently been 5 to 7% of the population. And that 5 to 7% of the population who trigger those, we are then able to get into the right care and help them be part of that system of care, not just something they did on an app off on the side.
Katie, I'm sure you're thinking, I'm sure you're wanting to respond to this, because one of the recommendations, and it's one of the things that we've talked a lot about in how we take next steps with implementing the recommendations, is what is the role of the C-suite? And how can the C-suite of employers really help with driving this agenda? Can you respond to Caroline's comment about they just put it on their website, or maybe they didn't even do that?
And this is why I think it takes sort of best practice sharing, right? And conversation all the time about what's working, what's not, especially, and that's what a lot of our advisory board does. They do a lot of best practice sharing and what's working, what's not, because, you don't have health, right? Mental health is just a condition of being human, is what I like to say, right? So in the C-suite, we talk a lot about, I'll say it here, but we really try to stay away from breaking stigma, because our work that we did with Meadows talks about when we're talking about breaking stigma or breaking it down, it actually reinforces it. So you approach it from the standpoint of hope and solutions, not stigma. And so when you start working with the C-suite and understanding that, I think, I love these conversations. I mean, I've learned a lot just listening to this panel, right? And things that I'm, sort of rolling around now on the work that we're doing. But specifically, a lot of the times when we're talking to employers and their workforce and their employees, a lot of what we're talking about is how are we educating them on things that they could possibly be impacted by they don't even realize until they realize it. Right? And so a lot of it is how do we educate around like mental health and experiences and trauma points or things that people are dealing with that they don't even realize sort of is having an impact on them until it sort of comes back to them. Right? And that's when you start entering into points of crisis and you start entering into lack of access and stuff like that. And so if we sort of back this up through the C-suite to create a lot more knowledge, education, awareness, and making it okay that this is just constant conversation about experiences that we all have every single day, whether it's leaders in the C-suite on hard situations they're dealing with, right? Leaders deal with this stuff all the time. They're carrying their own, but they're also carrying a fraction of everybody on their team and everybody in the company, right? And so it's how do we sort of educate this and back this up, right? So it becomes part of the fabric and the quilt of every organization and every employer that we're helping to empower people to understand what may be impacting, what may not be impacting them, and then how do we manage things and think through things and deal with things, in a positive way, moving through. So, that was a lot, Casey. I don't know if that answered, your question, but we are very focused. 3 of our employer-facing recommendations, we have 25 recommendations. 3 of them are employer-facing, and it deals a lot with what we can do from utilizing best practices of what's being done nationally with the American Psychiatric Association is a great example of this. Meadows is constantly coming to us with best practice ideas that are happening on a national scale, toolkits for C-suite, but how do you actually integrate this? I don't think it's about a program, right, to your point. Right? We know the adoption of EAP and all of that, there's not a high sort of utilization on that, right? So we have to sort of think about it different. We have to approach it different. We have to talk about it different. but from a place of solutions and hope, not from here's another program, here's another app, here's another technology and tool.
Great. Caroline, I saw you raise your mic, and Josh, I am not leaving
Sorry,
you out.
I have to jump in.
I'm having a great time. This is awesome.
I love it because I loved part of what you said about, what you were doing, and I think it's so important to understand the changing landscape of mental health care needs for our employees. We worry about our kids going to school and having terrible outcomes in school during the day, and our kids worry about those things. Our kids are worried about climate change. We're experiencing, devastating climate change in Florida especially, which leads then to higher rates of alcohol use, higher rates of other substance abuse, higher rates of post-traumatic stress disorder. And so as employers, we have to be ready to pivot what we're doing to meet what has become a changing landscape of needs for our employees and the kinds of things that, if you want to put it in dollars and cents, drive down productivity and encourage absenteeism. We don't want that. We want people to be, as fulfilled as they can, so that tact that you're taking in listening to employees and never staying stagnant, knowing that what you're doing has to evolve over time.
Great. And so, Caroline, that actually was a great sort of segue, because I really do want to pull Josh in here. One of the surprises that we had in working with the Chamber and their stakeholders was how interested they were in thinking about youth and early intervention. And I was thrilled that they wanted to include youth as part of the assessment that we did, and recognized that if their employers' kiddos were struggling, then they weren't showing up to be the full and best employee that day. And so part of the assessment includes a lot of content and recommendations on early identification of risk and care for youth through healthcare, but it also includes some recommendations related to the role of schools. And Josh, Hazel is operating in 40% of the school districts in Florida. And so can I pull you in here to talk about how you're thinking about the role of schools in identifying people who may be struggling earlier in their struggles?
Absolutely, and thank you for having me. It's actually fun because I'm thinking about this with my hat on as an employer, and what do we design for all the 500 amazing teammates that work for Hazel, as a parent of 3 sons. And I will say one of my boys had a real significant mental health need, and despite working in healthcare and having all these accesses, it was so hard to get him everything that he needed. And that's part of the goal of what we're trying to solve for in Hazel Health is there is just such a struggle with access. There's a lot of phenomenal providers out there, and we're just really struggling connecting them in. And so what we do is we work in partnership with schools, with health plans, and more with states to try to solve that access issue. And our hypothesis is if we can meet kids and families where they are, and for kids in schools, that we can address that. And so essentially the way it looks like is we're creating virtual health clinics in a school setting where a child during the day can see one of our, via iPad, all telehealth, can see one of our mental health clinicians on the other end. We also have physical health services, so they can also see one of our doctors. But the goal is every single child has access. It doesn't matter if they're insured, it doesn't matter what their benefit design is, and a very diverse group of clinicians, and so more than 50% identify as people of color. We speak more than 30 languages fluently. And so as we, because the hypothesis is, could this help solve that for kids and for their parents, for folks like me that are trying to tackle those issues. So in Florida today, we've done about 400,000 virtual visits in our experience, but about 200,000 of those have been in the last year alone, and about 10% of that has been in the state of Florida. So we're in about 18 states now, but Florida has been sort of bread and butter, and it's from Duval County, which is Jacksonville in the north, all the way down to Miami-Dade in the south, and a lot in between. And we are finding the big questions we had is like, first, does this improve access? And we're getting great data that's saying that if you make it easy available, if you are enable the parent, whether the parent reaches out or we start with an adult that maybe is seeing behavior playing out in the classroom, that will folks use it? And the answer has been a resounding yes. And we're seeing a really diverse group of kids from across all of these communities. The second question then is, okay, well, the access is great. What kind of outcomes are we seeing? And so when we look at, our first set of work we did was with Clemson University, looking at things like PHQ and GAD scores. And we were thrilled because what we found is that we were seeing about 40% of the kids coming in were either severe or moderately severe for things like depression and anxiety. And honestly, as we were getting going, I think in the beginning the question was, well, we're going to see kids who are more of, it's a classroom behavior thing, but it's much more mild. And unfortunately, we saw a lot of kids, including a lot of kids that really do need to get seen locally by a local provider, but the family hasn't known where to start, so they can start with us. And what we found in the data is that even though about 40% of the kids we're seeing are at those levels, we're seeing a 75% of the kids in the study had a clinically significant improvement in depression or anxiety, and about 70% of them, we got all the way down to subclinical levels for those pieces. And I want to flag, this was at an average of just over 6 sessions, because we also are very mindful that if you want to tackle this access issue, there is a finite amount of not just providers, but also it's very, very expensive. And so we've had the mindset of how do we make sure we're getting enough and getting folks to great outcomes, but also building a model that's sustainable. If with my CEO hat on, and I want to serve make sure all of my teammates can get their kids support, it's got to be sustainable. The part on the outcomes beyond that, because that's great, but you're like, what does this actually mean now for kids and their parents? And so it's not yet published, so I can't mention the district, but one of our districts in Florida, what we're seeing is you get those impacts, so what happens? And so we're seeing 85% of parents are saying they're seeing a noticeable difference in their child at home. We're seeing a significant reduction in school-related behavior events of needing to be referred in. We saw just over 40% reduction in chronic absenteeism, which is kids who are missing a whole bunch of school. And then the last data point is it was about a 4% absolute increase in attendance. And what that means is for a child, roughly about a little bit over 5 more days of school for kids that were using our service versus those that weren't. And that's huge, because that's not just, obviously, most importantly, learning time for the child, making sure that they can be successful. But with my parent hat on, this question of just how much time am I missing from work? Am I having to take time out? Because especially if the kids can see our therapist during the day at school while their parents are able to work. But also just my presenteeism too, because I will say as a parent, when I'm a terrible patient myself, but when my kids have an issue, it doesn't matter how important my job is, it is really hard to be present for all the things I need to do for my team when I feel like my core job is to make sure my kids are safe. And I'll just say, I'm both ecstatic that the Business Council's Chamber of Commerce is engaged, and I do think we need to applaud our schools, because this is not what they were built to do. And they're stepping into this because someone needs to. The data says that schools are 6 times more likely, it's 6 times more likely to be able to access at school than elsewhere. But we have to all come together to support them, and we're thrilled. I just would give a shout out to Sunshine Health Plan, the Centene Plan, and United, where health plans and other entities are now saying, okay, our job's not to help Hazel, our job is to help schools tackle these issues.
Great. Katie, I saw you raise your mic like 3 times, so
sorry.
chime in. Yeah.
I was just so excited.
Last time, Casey. No, I mean, so youth, right? Why this is veterans, youth, first responders, right? That is all accounted for in this work that we've worked with the Meadows. So we're going to continue working on it moving forward. But when you look at kids in our schools, right, it's all about the connectivity of all of this. That's our workforce. So when you talk about our current workforce, mental health needs, right, like our schools, our kids, that is our workforce. So if we want a sustainable workforce of growth in the state of Florida to be 10th largest economy, the 5th largest economy, you have to make sure you're addressing the workforce through the entire pipeline. And so what we did with the Meadows Institute actually, built out a dashboard, right, on behavioral health and access and a heat map on all of this that we integrated into the Florida Gap Map. And when you go to the Florida Gap Map, it's run through our foundation, you can see every zip code in the state of Florida and how many kids live in poverty in every zip code. You can see all the elementary schools and how many kids can't read at elementary or at 3rd grade reading in every elementary school in that zip code. And it's not just to highlight the problem, but what we do is we go out and get private sector leaders that adopt those zip codes. And so they solve it then from a community-based solution standpoint, right? So Florida Blue adopts 5 zip codes, right? Disney adopts zip codes, and then they solve it from the local level. Because when we talk about our youth, we have an incredible, education system in the state of Florida, right? But we have strict testing, third grade reading scores and testing, right? So kids in our school systems are on a bit of pressure and a bit of that on third grade reading scores and testing, which does create a mental health need of pressure and stress. And we can create more resiliency in our youth if we make sure that they overcome it and they achieve. But when you've got kids not reading at third grade reading level and they're not thinking they're smart, they don't think that they know how to read, or they're not a good reader, it goes to self-esteem. It goes to their mental health, which will follow them right through their years. And that is our future workforce. And so when kids get to be 18 and they think, I struggle with reading, I did this, but I overcame it, right? That's how you get an incredibly solid, resilient workforce. Just wanted to add that, Casey.
Thank you for chiming in, and I love the reminder of the commitment to data and outcomes, and how, even though you all are looking at this at a state level, the solutions that you're driving really do come from the community level. And Josh, I really did appreciate that sort of last statement that you made, that schools are not designed to be healthcare settings. So Caroline, I'd like to pull you in here about how you think about connecting our youth with care and the role of schools.
I think the role of schools can be exactly that, the connector, and the work that Hazel's doing is really tremendous. There's one thing that you said that I absolutely loved, which is clinically significant improvement. So there are a lot of companies out there that say, well, we improved the PHQ score, and I'll say by 1 point, or what did that mean? And there are research definitions for clinically significant. And it is huge that Hazel is doing this work and driving that kind of measurement of what they're doing. So back to the question about linking into schools. Again, it's part of a system of care. And so for the schools that are collaborating with an organization like Hazel, organizations like that then need to be linked into community service organizations. There will be kids at some point who are going to experience the kinds of symptoms that are above and beyond what can be cared for in a telehealth visit. There are kiddos who, to your point of living in poverty and not being able to read, will need services that are above and beyond what we can do in telehealth. And we have to have the community partnerships. So organizations like Hazel and your organizations working on zip code level and community-based services, I think the role of schools is to help bring some of those together. The schools know what's happening in their neck of the woods and who the deliverers of sources to fix social determinants of health, to fix food insecurity, to fix the other things that contribute to the mental health that we're seeing, or the poor outcomes that kiddos in general may have. So I think schools really can function not as a provider, but as a convener.
And wouldn't it be a fantasy to have those telehealth visits actually connect into the data infrastructure that Kathy was talking about at the beginning of this session? So Katie, I'd love for you, as we're sort of wrapping up against our time here, can you share how people in the audience might be able to get involved with the work that's happening in Florida and any innovative opportunities to engage here?
No, absolutely. I mean, so through our Health Council, chaired by Dr. Coleman, every bi-monthly we have Health Council committee meetings. And so we engage over 200 organizations on all those calls. And what we're doing is the work and what we work with on the Meadows Institute is now systematically and very focused going through each one of those recommendations and putting solutions behind what tactically are we doing in the short term, specifically on the employer-facing recommendations, and then what are we trying to do through legislative priorities in the 2025 session that are going to take, 2 years, 3 years, 4 years, 5 years to move those things forward. So, I'd love to have people engaged in our work of what we're doing in Florida. As part of that, we have some of the best organizations involved with Blooming Brands and Johnson & Johnson on this work. And the more people we have engaged in this and best practice sharing and ideas and all of that, we're going to be able to move this much quicker in a more systematic way with a blueprint, right? And through the research that we did, it was all about looking at not just static data, was taking the static data, but then what we did is we broke it down into interviews. And so Casey interviewed all of the key stakeholders in the state of Florida and talked to talked to government, we talked to nonprofits, the health systems, the health insurers, and the private sector to say, what is everybody currently doing? And then how do we engage and create the blueprint so everybody can play their role, their part, and use their best talents and skills, but have it to be aligned in a direction and understand where we're trying to go and how we're trying to get there. So nationally, I cannot speak more highly of Casey and Dr. Keller and the work that they do, right? So we're very engaged with them. So if you're outside of the state of Florida and want to know like how to engage in this work and what you can do within your states, Casey is a tremendous, resource and help on that. And I think, any questions you can ask Casey, she can connect us into Florida, and vice versa, and we can actually sort of bring this to a national standard, not just from Florida, but across the country on how we do this and do it well and get everybody engaged in it, because it's going to take everybody. I mean, it's not just going to be us.
Yeah, well, thank you, Katie. I appreciate I appreciate the commitment to partnership and collaboration, and that's been one of the best parts about working with you all is this mindset of really leaning into the opportunity to build a mosaic of solutions in Florida through national partners and local partners. Okay, I think we have time for maybe one question if you want to stand up and use the mic, and just please introduce yourself.
Hi, I'm Blake. I'm a child psychologist in California. And Josh, really curious, what's been your experience working with, I think school districts is what you work with, right? As far as the buy-in from them for you to both educate their system, to not silo information, and to really partner with them. Because as Caroline said, a lot of times kiddos may need more acute care, although I see the access to specific care, but also a diversity of clinicians. It's awesome that you're doing, so I really applaud you for that. So I'm curious what your buy-in level with the district is.
Yeah, thank you for the question. And I'll say we're almost 8 years in, and so we've learned a lot along the way, because schools are wonderful systems designed to support and educate kids, but not designed for what we do. And I think we had to start very much with, this isn't about how do we reach a kid, this is how do we support you, school district, and all the things you're trying to do, and how do we bring our services to help you, and design everything from the regulatory environment, understanding how unions might work. As we found them, if we do that really well, really receptive. What's interesting, we were talking before, is we're finding more and more sometimes superintendents wanting to talk about this, not just for their students, but more and more for their staff. Because the mental health crisis is, both those are parents, and a lot of these teachers or bus drivers, like a lot of the folks that work for the district, they're also seeing a lot of they're firsthand seeing all these challenges the kids are going through, and the staff are actually often raising their hands saying, we need something, not to say Hazel, but something like Hazel, which is, it's exciting to think about that being part of the solution as well.
I lied. I think we have time for one more question, if there is one in the audience. All right, there's one more. Great. Josh, you were very succinct in your answer. Yeah.
So I asked this question yesterday, but it seems to me that no one really wants to give a straight answer to which company is, or how you recommend companies to go about using or technology for outcomes. Like, is there a brand that's the best brand, the Rolls-Royce of outcomes? Is there, and of course, NeuroFlow seems like a solution for Magellan, but is that a solution for all behavioral health companies, or is that really in a hospital setting? So really just how do you really decide about how to go about, finding a company that can get the right outcomes, and do you want that company telling you what are the important outcomes, or are you deciding as a company, this is going to be the outcomes that we're going to look at? So,
Cappy, you want to take that?
Sure.
Yeah.
Thank you for the question. I'll try to be as quick as Josh was in that. I think first and foremost, Find a partner that's actually going to work with you, right? Align around your mission, your strategy. Think about the goals you want to do. We're in this together. No one's got the perfect piece of technology out there. We're all working towards improving and moving in for the fabric. I would love for you to use NeuroFlow, but that may not be the right solution for your organization in determining on what you want to serve out in terms of assessments or integrating into the workflow or thinking about your rules engine and what you want to be able to do. But these are the questions you should be asking your partners, because we need you to have that infrastructure to solve this problem. So I really think about it as find a partner with humility. I've learned a lot from Dr. Carney in the short time that I've worked at NeuroFlow, about 1.5 years. But I think the lessons that I take away from her, and I think this is important in the relationship, is how do you find a working plan to go together? How do you come into that conversation as a technologist with your shoulders down, right? We need to learn from the doctors. We need to learn from their patients. We need to learn from the members, and our technology needs to work for them. It's not about them working for the technology. So, and that takes a lot of creativity. Sometimes you get it wrong as a technology company, and you need to lean into that when you are wrong. So that's really what I think about. I don't think there's a perfect selection of technology. I think you want to find a partner that knows and grows with your business and is humble enough to learn with you. And I think that's what we should be evaluating on, right, from that perspective.
Thank you, Cappy. All three of the other panelists raised their mics, so I'm going to actually we're just going to go down the aisle, and I'll be in trouble with the organizers. So I'm sorry. Caroline, Josh, and Katie, anything to add?
Sure. I think the technology partner, building on what Cappy says, has to be able to be flexible and work with your company, but they have to have a platform that brings you actionable data or brings providers actionable data, and one that, as I describe, is more like a Swiss Army knife. Our members, our patients, don't need 10 different apps on their phones and have to navigate which one does which for me. So a tool where it helps the individual get what they need inside the tool and be able to approach what the types of services are sitting inside the same tool, and or link seamlessly to a more specialty type of tool. And then finally, has to be able to collect the data in a way that we can truly do the measurement-based care. A tool like NeuroFlow and many others can seamlessly go from health plan to provider organization to community organizations. They should be able to do that. That should be a minimum requirement.
Yeah, and I'll say we've outsourced, we've typically partnered with universities. I think our goal, so it's more of what, for us, the goal would be getting data and research that isn't just a sort of a mirror of how we did, but something that's really a window to say, how do you both assess what you've done, but help us inform our protocol development, and how do we actually kind of do the subgroup analysis so that, because we know our kids are so different, how to make sure we're really optimizing over time and looking forward.
So I'm not going to disagree. I think everything you all have said is absolutely spot on. I'll approach it from just a very different sort of just standpoint, mostly because my viewpoint is from the employer side and the employee-led side. But I would start by talking to your people, right? Because every industry is very different. And so if you understand sort of what your workforce is and some of the nuances and the specifics of the industry that you work in, you will start to understand. And if you ask them, there will be a commonality about whatever it is, right? That's sort of the underlining thing that we're trying to solve through product, technology, and app. But every employer is different, right? We've all defined our cultures a certain way, our core values, our missions, but then every industry is very different that has some underlining mental health things, right? Like in construction, as an example, has some very different challenges than maybe professional services. In the construction field, right, we've got circadian rhythms on sleep, as an example, right? On our line workers, you know, we have hurricanes in Florida. And so we've got line workers that are out all the time trying to restore power, but they're working around the clock, right? That's impacting their sleep. It's their circadian rhythms, right? So the challenges that they're having that we're trying to solve around mental health is very different per industry. And so there's a lot of organizations I've worked with that have been very effective and have really figured out the right tool, the right solutions by first talking to their workforce, working with HR and saying what is sort of the commonality of what we're dealing with that may be industry specific, and then what are sort of the nuances that are specific to our organization. And then you can sort of go out and really assess and then utilize all the criteria that they have talked about. I can't disagree with any of that. That is certainly spot on. So that would sort of be my approach to, before you get to what is the best product, is what is the problem you're trying to solve.
Great. So I just want to repeat, like, know your customer, listen to your customer, and be adaptable to meet your customer with what they need. So we do have to wrap, sadly for me. But I just want to thank the panel and just reflect upon how hopeful I am today, because there are these diverse perspectives that are coming together to try to help us create better solutions for more people who need mental health services and who we want to thrive. I mean, who would have thought even a few years ago that there would be a stage at a mental health conference that would have someone from a health plan, someone from representing the employer community, someone recommending the opportunity in schools, and someone recommending the opportunity for health systems and data infrastructure to all be on the stage together. So can we please give them a round of applause?